Hi, this is Renu Wang from MHC. Today we're at Grand Coptham Waterfront for the second annual Healthcare and Insurance Collaboration Forum 2011. Dr. Low Lee Yong is invited to be one of the panelists to speak about balancing necessity of treatments with cost. Let's take a look.
To follow up with Dr. Lincoln Chi's word about patients not having enough information to make the right decisions. I think right now the contrary is true, that patients are having too much information, and that is probably leading to the cause of a lot of wrong decisions. The fact is we are, especially the private market, patients is king, literally. Most people at least still regard as a customer or the patient as king. And they will try to do their best to please the patients. And when the patient come in, they can just print out, a printout from Google about certain conditions, and they demand an MRI, they demand a CT scan. And if you're a specialist or a GP, you don't do it, what does the patient do? They go to the next door. And the next door is more than happy, especially if it's a younger guy now, to fulfill that, you see. So it's not so much lack of information. I think right now it's really we're flooded with too much information. The demand is there, the patients want this, want that. So as a doctor, what do you want me to do? It's very tough sometimes. And of course, if you're in the private market, let's face it, you got overhead to pay, you got a renter, you got nurses to pay, You have to think of your own survival too. So most interestingly, I find that when the specialists work in the government hospital, they are able to confine themselves with a certain policies, according to the certain policy and treatment protocol. But when they go out to the private world, they are slightly different set of constraint coming, because previously under the government service, the overhead, the nurses, the rental, all paid for by the government. But now once you go into private practice, there are other concerns now. The reality of life, the reality of making a living comes in. So the practicality of a business comes into the picture. That is the unfortunate facts of life. And then, why do people abuse the systems? I think the big part of our healthcare market is funded by the employers, and indirectly, therefore, funded by the insurance. And if someone is paying for it, naturally, as an individual, you tend to demand for more, because after all, it doesn't come from my pocket. I think that is primarily one of the problems. So one of the issues we have to ask through this panel discussion is, how can we put in checks and balance and to ensure that this do not happen? Are there audit? Are there mechanisms, standards, or systems that we can put in place to make sure that all these abuses do not happen, and especially so they don't happen at the point of transaction? Is that even possible? A lot of time we pick out all these abuses sometimes many months or years after it has happened, and that is the sad part.